All right. So, first of all, let's start with introductions because, again, we don't want any strangers in the room. My name is Obi Oji. I'm a nurse practitioner and I work full time at University of Texas here in Houston. I work in the Galveston area and I teach nurse practitioner students. And so my team and I, we have worked in the last 4 years, really just making sure that, we're educating our nurse practitioner students. We do that in several ways. We have workshops that we offer for continuing education classes, and we offer both the live and the enduring materials that nurse practitioners, physician assistants can access at their convenience. And so with our experience just working in I say academia, but experience working in the workshops and just hearing the feedback that our new nurse practitioners have with regards to clinical skills, my team and I built this website it's actually a virtual simulation website. And what it does is that it does help to teach procedural skills. And so I wanted to introduce Sim Skills Made Easy to you. I will talk a little bit about artificial intelligence and how that would help us in medicine, in healthcare, in nursing, again, depending on where you are. So I just wanted to make that quick introduction, and hopefully that gives you a little guide of what this is all about. Okay, so the learning objective for today is really to talk about how we can transform education. So we definitely want to transform education of healthcare, right? Students in healthcare. And we want to do that using simulation as an excellent method to promote that translation of content into a clinical context. And then, of course, the simulation technology would help students to develop psychomotor skills. And then, of course, that helps to prepare them for their clinical skills and the clinical decision making in future. So a couple of things that we talked about, and again, we kind of thought through is how artificial intelligence is able to help us in healthcare. So software, I'm sure you all know a little bit about robotic surgery that is being used now. Artificial intelligence is here to stay, is really not going anywhere. A formal definition of artificial intelligence is the use of software to reproduce or mimic human behavior. So AI is especially useful for creating simulations of surgical procedures to allow trainees to practice skills in a controlled environment. So AI is also useful to develop a better understanding of the complex task of clinical skills. Again, I mentioned surgery, but also even in nurse practitioner education, AI is really going to be with us for a long time. All right, so I did, of course, I did look in the literature just to see what the literature says about the use of AI in graduate education. So, of course, the COVID pandemic. All of us, went through the era of COVID, and we actually were scrambling to find, okay, well, what ways can we continue learning? How can we continue to teach our students how to be the best practitioners that they can ever be? So again, that COVID era disrupted graduate education across the world. It did force educators and students to devise innovative solutions to continue learning. So I did look at this pilot study. This study is a RAST-NP pilot study from the University of Minnesota. They demonstrated that utilizing psychomotor practice increased confidence in nurse practitioner students. And they also suggest that the amount of time spent practicing skills is associated with the interval, of course, that it took for them to increase their confidence in the clinical skills. So again, we can talk about the cognitive and the psychomotor, and we can talk about all of that. And there's a place for didactic, but there's also a place for the clinical skills. It's by itself. So again, I guess the moral of the story with this pilot study is really just making sure that we're immersing our nurse practitioner students in that clinical environment where they're able to gain confidence in their clinical skills. So there's another literature by Gonzalez Navarra in 2021 that talked about suturing and not just suturing, but clinical skills in general, but suturing in particular is considered the cornerstone of graduate student training. Ideally, students should be familiar with basic skills before working on patients. Although that's not always the case, right? So there's a lack of formal training courses or resources in graduate education. I realize that some schools are actually bringing in students to learn this, this clinical skills. Sometimes it's really sparse, compared to what the students actually need for their training and for their future as nurse practitioners. So again, Gonzalez really talked about this literature talked about how create the lack of formal education could create an ethical and medical legal conflict, which schools should address. So again, I'm just going to segue and talk a little bit about sim skills and what we've done with the virtual simulation and how this could be used in your practice. This could be used in your school. And really to help the students to gain confidence that they need to go out there. The employers are looking out for students that need the skills, and that's why they come to our workshops. The employers really need students that are quick on their feet, students that are able to demonstrate clinical judgment really quickly. So again, that's really going to be helpful for us to have our students prepared from day one, once they graduate, that they're able to perform the skills. And then, of course, we talk about AAMP and the ANCC. This would be your...
Dr. OG, there's a question from one of the students. Bob, he has a question.
Oh, okay. Okay. So let me pause for a minute and sure. Bob, you can unmute your mic or you can just drop your question in the chat. Okay. Yeah. Okay. All right. So let me just move along and talk about AAMP and ANCC and really just, talking about what their required skills are for nurse practitioner students. And then, of course, just taking a look at that, they do require that students learn the clinical skills like your suturing, your incision and drainage, toenail removal, all of those type of skills are actually required by our certifying bodies for nurse practitioner students. All right, so I'm just going to move forward and talk a little bit about the simulation components. So there are 4 components. There are 3 components, and then there is a test your skills component. So we know that the know the procedure is a quick video that really just helps the student to learn a little bit about the skills and what they would be learning. So again, in this case, we've built out the suturing skills, the simple interrupted suture skills. We've also built out a case scenario. So that case scenario is based on an urgent care practice where we're able to, that your typical patient will use a digital patient to, teach that skill. And then, of course, perform the procedure is totally just immersing this patient in that environment where they're able to perform the procedure. So again, it's a little sandbox for the student to just go ahead and, practice as many times as possible. We did a pilot study with Houston Baptist University, and we just had their students pilot the software for a couple of weeks. It's around 6 weeks or so. And one of the students in her evaluation, she said that she just brought out her suturing material and she practiced along with the simulation. So that was very helpful to hear. And then, of course, test your skills would be a graded component where the students actually going and test their skills. And of course, they will have a grade at the end of it. All right, so going into more detail, this would be the know the procedure mode. So again, you can kind of see a snapshot of what the students will learn. They would become familiar with the equipment that we use for suturing. So your tissue forceps, the needle driver, and of course, making sure that they know how to anesthetize the skin. There would be some literature, and the didactic portion does include some information about how to select your anesthetic agent. and then loading the needle correctly, repairing the laceration, tying the knot correctly, and then securing that knot will be part of the know the procedure. And then, of course, the simulation case scenario, I kind of talked about this already. So this is a patient, a digital patient, just like your patient that you see in your clinical practice. And so the student would learn that, how to ask questions. So the relevant questions that is required in this case scenario. So they would actually match the prompts to the patient's response. So again, really teaching the students how to be able to ask the relevant questions if a patient comes in with a laceration that needs to be repaired. And then perform the procedure mode. So this is a little sandbox I talked about where the student is actually performing the procedure. So they're learning how to pick up the forceps. They're learning how to position the needle to pierce. They're learning how to pierce the skin and tie the knot, secure the knot. So this is again, the students have sufficient time to practice on the digital patient several times before going into clinical practice. So again, this would increase their confidence because they already have this at the back of their minds. They already know what to do. And so the test your skills, it does include 11 questions. So again, each test represents, all what you need to do when you're suturing, and then making sure that the student gets a grade at the end of it. They have 3 attempts, and of course, the highest grade would be the grade for this activity. And of course, it does depend on the instructor and whatever they want to do with it. If they just want it to be a one-time test your skills, so it's fine. We can tweak that to fit whatever the instructor really needs as a means of evaluation. All right, so what's next? I guess that would be the question. What's next for you as an instructor, as a professor in your college, in teaching nurse practitioner students, teaching graduate nursing students? So what does Sim Skills have to offer? So a couple of things is that Sim Skills, we do offer the digital patients that mimic real world experiential learning. So this does encourage the students to rehearse and refine their clinical skills in a safe environment. So virtual simulation provides an opportunity to acclimate to the changing educational landscape by continuing to provide indirect clinical experience in a safe environment. So with Sim Skills platform, no patient who is alive is put at risk at the expense of the student. So the student has ample opportunity to rehearse and to make sure that they're confident in the clinical skills before going into the real life practice. And Sim Skills simulation provides a standardization of cases. We know as instructors, as educators, that no clinical practice is the same. So you have a student that goes in and they learn all of the simulations, they learn all of this clinical skills, maybe in an urgent care setting or in fast track ER, and then you have the other student that goes and they did not suture, they didn't learn any of the clinical skills. So again, this provides a standardization of cases where the student can actually think critically. It does allow for supervision because the educator, the instructor is able to see how many times the student practiced, and they're able to provide immediate feedback to the student to help them transitioning to their role as nurse practitioners. So this is what we bring to the table. Of course, I have my references here. First of all, I want to ask if anyone has any questions, but I want to make sure that I did go back and show you what the simulation looks like in a minute. So I'm just going to go ahead and entertain any questions anyone has, and then I can kind of go back and show the simulation itself. Does anyone have any questions, or should I just move forward? Okay, all right. Okay, so I'm going to stop sharing the screen and I'll pull up the simulation in a minute. Let's see if I can get it. Just bear with me for 1 sec. All right, so let me, I'm just gonna, hopefully you can see my screen. So this is what the students will see when they log in to our simulation platform. This is a sandbox for HBU, Houston Baptist University. They had used just for the pilot that we had put up for the students to kind of play around with. So this is a course outline, so you can see the overview, the different sections, there 3 different sections. So the course outline is, it does include the didactic portion where the students are learning laceration repair principles. They're learning wound closure types, wound management, anesthetic principles, suture materials. They have to think about absorbable versus non-absorbable sutures. Then of course, suture removal, tetanus prophylaxis, and there would be a post-test afterward where the students are able to again, test their knowledge and hopefully gain some insight on what they did wrong. And of course, they can go back and repeat it and whatnot. Then the section 2 does include informed consent. So again, this would be where the students going and they're learning about informed consent. We have lots of questions in our workshops about informed consent related to skills. Okay, so again, clinical skills like suturing. So we did make sure that we added this to the virtual platform so the students can interact with it and see what that looks like. And then, of course, the simulation, and I can kind of click on that a little bit so you can see what that looks like. So again, the student can go to the module 2.2, which is a simulation platform itself. So once they click on that, they're able to view the platform. So I'm just going to pause and let it load, and we can kind of look at it together. All right, so so that would be the little intro to the simulation. Let's see. Can you all still see it? Okay, all right. Okay, so again, this would be the overview. So the students are able to see their progress. The students are able to, read the information that they need really to go through and complete the simulation. And of course, once they hit the continue, they're able to look at the things to keep in mind. So again, know the procedure mode, perform the procedure and test your skills. So the 3 components for them to learn, perform, and then test. So there is on the left-hand corner, upper left-hand corner right here, the students are able to go through the menu. So they can go, there's really no perfect order. So if a student, maybe is in the case scenario section and they feel, well, I really still want to learn how to perform this procedure, they can go back to know the procedure. So they can go back and forth. But once they get into that test your skill zone, they have to, it's a timed test. So they have to complete that. Again, it depends on how many attempts that the instructor or their instructor for the course or the course coordinator wants for them to spend. So how much time they want for the student to spend with each module. Okay, so I'm going to go ahead and just click continue so you can see what that looks like. So this would be
the video on simple interrupted suturing technique. In the Know the Procedure mode, you will be able to learn the steps involved in the process of simple interrupted suturing technique. To help you understand the simple interrupted suturing technique, we have divided it into 7 segments. Each of these segments will be discussed in detail.
So again, this would be the students going in, they're learning how to, perform hand hygiene, cleanse the wound, anesthetize, load the needle, repair the laceration, tie the knot, and secure the knot. So this would be really helpful for the students that, have no clue how to perform your procedure. So they especially suturing, so they're able to actually see in real time that, a laceration repair being performed. And then, of course, they can continue on to the case scenario.
Mr. Mina is a 57-year-old Hispanic construction worker. He is here at the urgent care clinic after sustaining a 7.5 centimeters laceration on the right anterior mid-thigh 2 hours ago.
So, hello, could someone help me, please?
Ask questions to get a basic patient history. As a clinician, you will need to obtain a patient's medical history. Use the drag and drop features to complete the activity below. Read the questions below. Drag an option and drop it next to the correct inquiry area.
So the student would have to do the matching. So this section right here really just teaches the student how to ask the relevant questions. Again, developing their review of system skills, questioning, eliciting the correct responses for each question that they ask based on the patient's history. Again, you know, we'll just have them play around with it. Sometimes they get it wrong, and but they have ample time to get the correct answers. But this really does teach the students, you know, again, just gathering that basic patient history that is so important. Of course, they can now move on to the patient's medical history. Again, remember that the menu on the left-hand side does provide, you know, a place where the students can move however they want, depending on what they need. So this will be the patient medical history. They're able to actually look at the patient's records, surgical history, medical history, the allergies that they have, the social history. They're able to look at the review of system, and they're able to look at the physical exam, so including the vital signs. So this, again, would help the student to get to a point where once they have to document, they have enough information about this digital patient, misdemeanor, to document why the patient is there in the clinical, in that clinical practice. So again, I'm just going to go ahead and move forward. I want to show you the perform the procedure mode, because again, that is the place where we have a lot of activity for the student, for the student. Okay, so this is the start of the perform the procedure mode, where the student has to learn, you know, the suturing technique. So in this case, I just want to give you a little heads up. There would be a portion of it where the student watches the task and sees how it's done, and then there would be a portion where they're actually performing the task.
Preview. Wash hands and wear sterile gloves. Observe how to perform the following steps. Wash your hands thoroughly to avoid contamination. Wear a fresh pair of sterile gloves.
So all the previews that you see, you'll find that the students are actually watching how that's done. And then when they have to perform the procedure, I'm just going to move along and show you how that looks like when they're performing the procedure. So load the needle would be a perform the procedure task.
Load the needle. For this task, you need to complete the following steps. Apply the needle to the needle driver. Clasp needle 1/2 to 2/3 away from the tip. You can use the task information button to the right to see these details of the task at any time. Drive the control bar at the bottom to choose the correct position of the needle.
So again, the student would have to use the control bars right at the bottom right here to position the needle driver and actually load the needle in real time. And if they do it correctly, if they're able to get that done correctly, they submit, they get a prompt. And if not, then they have to repeat it till they get it, you know, the right way. So I'm just going to do it wrong. And so you can kind of see what that looks like.
You have not performed the task correctly. When you close this message, you will be able to click the replay button to review your action highlighted in red. Observe your action replay.
So again, the student would have to repeat this till they get it correctly. So again, making sure that they're loading the needle 2/3 from the tip. So here.
You have successfully completed this task. You may practice again or explore the next one.
So I will move along and show you what that looks like when the student has to actually suture the patient, the digital patient that we talked about earlier. So I'll just move along and show you what that looks like. Okay, so this is a section.
Supinate your wrist. For this task, you need to complete the following step. Supinate your dominant hand to drive the needle from the epidermis to the full thickness of the dermis at a 90-degree angle. You can use the task information button to the right to see these details of the task at any time. Drive the control bar at the bottom to supinate the wrist to penetrate the dermis and reach the middle of the wound. Click
So again, this is what the student would have to practice. So they're able to have their suture pad right in front of them, and they're able to practice using the perform the procedure mode. So again, they have to get it correct before they move forward. If they're not able to, then they really cannot move forward. So let me kind of show you what that looks like. Hopefully I get it correct. Let's see, supinate. So that would be, let's see, halfway. All right. Okay.
You have not performed the task correctly. When you close this message, you will be able to click the replay button to review your action highlighted in red. Observe your action replay. Compare your replay with the steps in the Know the Procedure section. Note that the action replay will be unavailable for review once you move the controls for your next attempt.
Okay, so again, just really showing you what the students would have to go through. And if they get it correctly, then they move forward.
Task: supinate your wrist to pierce the skin on the opposite side of the wound. Drag the control bar at the bottom to supinate the wrist to penetrate the correct bite area.
So again, the student would have to get this correct. If they don't get it correct, then they have to keep repeating it so they get it correctly.
You have successfully completed this task. You may practice again or explore the next one.
All right, so the student would have to go through all the steps. They have to learn how to tie the loops. So I'm just going to show you what that looks like.
The suture around the needle driver. Observe how to place the needle driver above the wound before making loops. Drag the control bar at the bottom to make 2 loops around and over the needle driver using the long tail. Click.
So again, the student would have to go 1 loop, and they have to go 2 loops for the first time and submit.
You have successfully completed this task.
All right, so again, the student would have to just keep moving forward till they get to the final knot. And let me show you what that looks like.
Task: lay the final knot. Drag the control bars at the bottom to pull the 1-inch tail through the loop. Pull the 1-inch tail toward you and long tail away from you to tie the final knot.
So again, it's up to the student to make sure that they get that, pull the 1-inch tail and then tie the knot. And once they submit.
You have successfully completed this task. You may practice again or proceed to observe the next steps.
All right, so I just wanted to show you what the perform the procedure looks like. Again, where we do have the simple interrupted, we're hoping to add the toenail removal and the incision and drainage. Those will be the 2 next skills I will add on in the next couple of months. And so the last component will be test your skills. So the student would have to go in and actually get graded for—
When suturing Mr. Mina's right anterior thigh laceration, the clinician must correctly load the needle to the needle driver. Test 1. Load the needle. Use the controls and complete the task. Using the tissue forceps and the needle driver, load the needle correctly. Click Submit when done.
So the student would have to go through the 11 tests, questions, and get that done correctly. Once they're done, they get a grade for that, and they can now move on to documentation. And so I'm just going to X out of this. Hopefully this was helpful to kind of show you what AI can do, what virtual reality can do for your students. And hopefully this was helpful. So I'm just going to X out of this and let's see, try to go back. I guess stop sharing would be what I want to do. Let's see here. All right. So I'm just going to go ahead and entertain any questions that anyone has. Do you all have any questions at all? The documentation definitely will be sent to the instructor to take a look at, and they have the opportunity to, of course, grade the documentation, edit, give some student feedback so they know exactly what they did right or wrong. So that would be another portion where the instructor is interacting with the students based on the virtual simulation. Okay, I'm pretty much done, and I'm more than happy to answer any questions anyone has.
Obi, I think seeing this is really helpful, very, very helpful. I'm really impressed, and I had gone through that a while ago, but a long time ago, but I'm so impressed with how it really is very specific about the skills and how you're doing it correctly, and giving feedback when you haven't done, like say, putting the forceps holder at the right place on the needle. I think it's great and very helpful in terms of how you explained it.
Yeah, thank you. Thank you. I really appreciate that. Because yeah, again, everything that we've done is really based off of our workshops that we've had and the questions that we get often, we get questions about anesthetics all the time. And we're like, oh my goodness. Because students are like, okay, well, I don't know when to use lidocaine. I don't know when to use lidocaine with epi. What's the difference? Those things are important. And so we did make sure that we cover the didactic portion and not just the skill. So they know, okay, well, you don't want to use lidocaine with epi with your digital blocks. So if you're performing a toner removal and, and so forth. So that way the students are more exposed to that before even starting their clinical practice. Dr. Dorsett, are you there?
Yes, ma'am, I'm here.
Do you have any questions for me?
No, it was a good presentation. Thank you for including me in it.
Of course, of course. And Dr. Hemphill? I think she just, I think we lost her. Okay, all right, so yeah.
Looking at this from a faculty perspective, I smiled quite a few times to myself, because I could see how having the students use this would really help them, with getting the skills. Of course, it's very different when it is different when you actually are doing it on a real person, but getting and learning step by step the skills that you need for each step was really very helpful. I can see it being a great asset to a course and to having students have to go through the different procedures that you've outlined. I think it would be very, very helpful.
Well, thank you. Thank you. Thank you. I think we did make sure that we did the step-by-step so that the students can learn not just, okay, well, I can watch a video on YouTube. At the end of the day, you really did not get it, right? But this is an immersive environment where you can learn, and there's really no end to how many times you can practice. So you can go in and practice over and over. Like I said, that student at HBU, she was like, she just brought out her suture pad and she was just practicing with the digital patient as she moved along. So yeah. But thank you so much, everyone, for your time. I don't want to keep you too long. I'm very respectful of your time. Thank you so much for attending this webinar. And of course, there would be some type of email feedback just to see if it's something that you would like to learn a little more, do maybe a one-on-one, whatever you need to help to integrate this into your curriculum. My team and I are here to help with that as well. All right. I think that's the end of the webinar. Does anyone have any other questions, any comments, anything else?
The recording, it's still recording, I believe.
It is, yes. I will share the recording for sure.
I have a question, but I could ask it of you afterwards.
No, go ahead. I'm here.
What are you using this presentation for?
So this presentation,
one-time presentation, or is this one that you intend to use over and over again with different groups?
Yeah, I'm hoping to use it over and over with different groups. Again, it's really for faculty to just expose them to the idea of using AI for clinical skills. But yeah, definitely would be something that we'll use many times, and maybe even make it better based on feedback by faculty. But it is really just to expose, faculty, instructors, different universities, schools, colleges that teach nurse practitioner education. Again, just exposing them to what this can do for their students.
I can't help myself. Because I want it to be as great as it can be for you. I have a
Right.
couple recommendations or whatever, but they're just
Of
like
course.
editorial things.
Okay, okay, for sure. Yeah, I will send out an email evaluation, and you can feel free to give me that feedback. That would be great. I'll love that. All right. Well, Dr. Dorset, thank you so much for joining us. Unique, thank you for joining us. And of course, Dr. Giardino. Yes.
No, I was just saying, thank you. Thank
All
you.
right.
Thank
Thank you.
for-
Okay. Thank you, everyone. Have a great rest of the day. Okay.
right.
Bye-bye.
All right.
Bye-bye. Bye-bye.